Hey guys, how's it going? Tony here. So in this episode, what I'm going to do is I'm going to take you through two real claims that have been processed through Medicare Advantage plans. You're going to see the actual reimbursement, the actual adjustments that are placed on the claim by the insurance company. You're going to see the patient's coinsurance or copay. In this case, it was a copay. And you're going to see what they're paying. Now, one is an Anthem, Blue Cross Blue Shield Medicare Advantage plan, and the second is a Humana Medicare Advantage plan. So let's jump in and take a look. This first claim, this was date of service August 19th, 2019. So we're in the beginning of September. This was just a couple weeks ago. You can see the primary diagnosis, the secondary diagnosis. This is exactly what the claim went out as. And what I mean by that is, so you see the to and from date of service, you see place of service 11. Now here you see a patient payment in the first line item. It has the GP modifier, the diagnosis pointer, zero charge because it is a payment. And it was a $40 payment. This is what the patient paid at the time of service. We create a separate line item because we're not sure where the insurance company is going to credit that copay. We know that they have a $40 copay, but we don't know where they're going to credit it. And so 1 unit, but if you look to the far right, you see this little square, this box, it's unchecked because that information is not going out to the insurance company on the electronic claim. Now the second line item you see here, BS procedure code, that's the initials for the physical therapist who performed the procedure. The physical therapist is listed in column J as the rendering provider, but from a reporting basis, the way this particular software works, it's just easier for us to credit this therapist with 4 units by putting it right in the line items with the claim. But again, there's no charge, there's no amount applied, and the box is unchecked because it doesn't go out to the insurance company. This is strictly for reporting and internal use only. Now the next 2 line items, this is the juicy part. So you can see here, August 19th, we provided 3 units of therapeutic exercise, GP modifier, diagnosis pointer, billed $120 for the 3 units. The amount applied was $80, and we're going to get into exactly what that $80 is because that's not how much money we collected. That includes adjustments, reductions, everything like that. You can see that the check mark was there because it did go to the insurance company. And then the second line item was 1 unit, manual therapy, $40 billed, $40 credit applied, not payment collected. That's different. So let's get into this claim. You can see down here actually real quick where it says primary insurance payment $38.31. So big picture, the patient was responsible for $40 they had to pay out of pocket. That was the copay for this visit. The insurance company reimbursed $38.31 on top of the $40 the patient paid. So now we're looking at $78.31 for a 4-unit visit of basically active treatment, therapeutic exercise, and manual therapy. So now if we jump into each line item, you can see that for 97110 therapeutic exercise, 120 was billed, $19.91 was paid by the insurance company. That's not per unit. That's $19.91 to cover their portion of the 3 units. The $40 copay needs to get applied to this line item. Now, we haven't balanced this account yet, so that's why this claim is still open. But the patient paid $40, that's going to be applied here. So the total allowed amount would be the $40 copay plus the $19.91. So let's say $59.91 is what the allowed amount is for 3 units of exercise. If we want to just quickly say, let's say $60, so we're looking at $20 a unit for therapeutic exercise. The second line item, the manual therapy, they reimbursed $18.40. Contract adjust means we reduce our bill rate by $21.60. But we actually collected in our bank account $18.41 for the manual therapy unit. So between the 40 that was the patient copay, the 1990 in change for what the insurance paid, that puts us at 59, we'll say 90. And then the 1840, so 59.69, pretty close to $70 for the total collected for this data service. Now, there's no other insurance, no other payer. This is an Anthem Blue Cross Blue Shield Medicare Advantage plan. Right now, off the top of my head, I don't know if this was a PPO, HMO, what it was. We're in network with all of their plans, so we were paid as an in-network participating provider. But those of you wondering, what is the Medicare Advantage? What are those plans paying? This one just paid us, I just said it, upwards close to $70, just shy of $70 for 4 active units of care, 3 exercise, 1 manual. I've got one other claim in here. This is a Humana Medicare Advantage plan. So again, you see our primary, secondary diagnosis, you see our line items, you see who gets credited, the last line item, which therapist gets credited for the 4 units. But above that, again, we did 3 units of therapeutic exercise. We did 1 unit of manual therapy. Total paid by the insurance company in this case was $87.22. But now I know this plan, the patient has a $10 copay. If you look here at the bottom, so this is the line item for therapeutic exercise, 3 units. We can see the insurance paid $65.97. So we'll round up to $66. Contract adjustment of $42.68, and then another adjustment of $135. So these are the reductions from the billed amount. The $10 balance is the patient's copay. And then on the next line, we see the insurance paid $21.25, contract adjustment $18.32, secondary adjustment of 43 cents. So reason code 253, I'll look it up with you. Off the top of my head, I'm going to guess it's sequestration, but I'm not positive. But I'll show you where to find that information. So for Humana date of service, same CPT codes, we're looking at 65, 66, 76 with the copay, $86, $96, $97. Let me go back here and just... Yeah, primary insurance paid $87, patient has a $10 copay, $97 reimbursement for this plan, compared to the $70 reimbursement on the Anthem Blue Cross plan, compared to the $50 max allowed on some of our United Healthcare Medicare Advantage plans. And those plans have a $45 copay by the patient, and the insurance is paying $5. So there's some major considerations going on there if you're looking at being an in-network provider for United Healthcare. We've seen it through the boards many times. Definitely better to be out of network for United Healthcare. But I don't have a claim to process because we do things differently with United Healthcare Medicare Advantage. And we're on the way out of that contract. We just don't get them. We don't see them. We can't afford them. But from memory, the last one we had, the reimbursement was $5 from the insurance company, $45 from the patient. So guys, I told you I was going to show you bonus content, where to look up the reason code. Let me see if I can get out of here real quick. And I know you guys can't see the top of this, the address bar, but basically what I'm doing is I'm typing in reason code. Let's find it here, 253, yeah. So reason code 253. And I always mess up the language if it's reason code or remark code. Yeah, so I don't know if you guys can see this. Looks like you can. Medicare EOB sequestration payment reduction. So that is just a reduction. There's no way around. Why it's not listed on the Anthem Blue Cross plan, I don't know. What you don't see here is the MPPR reduction, which, again, this is the way the EOBs are coming in. I'm showing you from our system, exactly what it really looks like. So guys, if you need more information, if you have other questions, please post them in the comments. I'm posting this to YouTube and then sharing it out to the Medicare billing group. But as always, if you're looking for strategies to grow your private practice, if you're looking for ways to better understand Medicare and some of the other payers, and if you're looking for tools that'll help you reach the success you want, subscribe to the channel, ring the notification bell. This way you're the first one to know when we post a new video. In the meantime, I'll keep working on this. I hope this was helpful. Let me know what you guys want to know, what your questions are. I'll catch you in the next video. Thanks so much for watching.